honorable ministers, distinguished participants, members of the press. First of all, I register my profound gratitude and appreciation to Dr. Amit Taka, the Executive Chairman, and to Dr. Daniela Monene, Head of External Affairs of Africa Health Business, for the kind invitation extended to me to be the guest speaker during this opening ceremony at the second Africa Women Health Symposium, which is being held under the theme, A New Dawn of Partnership for Women's Health. Allow me latitude to first explore factors that in one way or another impact Africa women's health. But before that, I beg to underscore the importance of women in society. Women are the primary caregivers of children and elders in any society. They maintain peace, harmony, and order in the family by creating a favorable environment. Women are a source of inspirations to the children and the husband. Since women spend more time with children, they guide them with supervised freedom. Women are, in fact, domestic managers. They ensure that whatever resources is brought home is used effectively. Women take over the burden of childbearing and instill good behavior in children, as they are the primary contact with the child during those formative years. When I was growing up, it was mainly my mother who was ever present. My father used to be away with work and only come for a month or two and then goes away again. So a mother is the primary teacher to a child and pass over the social heritage, laws, and morals. She is the first to discover the traits of her children and plays a key role in shaping their character. It is from the mother that the child is able to talk, thereby learning the mother language, the mother tongue, and not the father tongue. The Universal Declaration of Human Rights enshrined the equal rights of men and women. In 1979, the United Nations General Assembly adopted the Convention on the Elimination of Discrimination Against Sex. The member states are obliged to establish institutions to guarantee women's effective protection against discrimination and take steps to eliminate all forms of discrimination practiced against women by individuals, organizations, and enterprises. It is evident that women have excelled in all fields, including journalism, sports, entertainment, culinary arts, among other professions. What are the social determinants of women's health? Now, given the special role that women play in society, it is critically important that they are protected from any harm or disease. Improvement in women's health requires a good understanding of determinants of diseases, functioning, and well-being, and the capacity to intervene in connection with the determinants. Some determinants are linked to specific disorder, while others have broad effects. Addressing common determinants of multiple diseases increases the potential for a greater overall influence on women's health. McGuinness and Forge assert that human behavior is one of the biggest contributions to death and disease. A substantial number of deaths have been attributed to smoking, physical inactivities, and dietary factors. It is recognized that women's health is influenced not only by biological mechanisms, but by a range of sociocultural, physical, and psychological factors. These factors include income and social status, social support networks, education, employment, and working environment, biology and genetic predispositions, and personal health practices. The theme of the symposium talks to the Partnership for Women's Health. It recognizes the importance of preservation of women's health. It recognizes the power of partnership in the sustenance of women's health. Partnership is a vital mechanism in the sustenance of women's health. Partnership for Women's Health are organizational models that brings together governments, international agencies, civil society, and private sector representatives into a formal collaborative relationship that is dedicated to the pursuit of shared health goals. During the past decades, partnerships have grown to become the predominant organizational model for addressing the complex health problems of developing countries. When the world was faced with the scourge of HIV, it gave rise to partnership in the form of a global fund to fight AIDS, TB, and malaria. The United Nations Economic and Social Council, ECOSOC, established the Joint United Nations Program on HIV in 1994 to provide leadership in response to HIV/AIDS epidemic and to collaborate with national governments, intergovernmental organizations, non-governmental organizations, people living with HIV/AIDS, and the United Nations system organizations. The principles of partnership are clearly embedded in the composition of UNAIDS and in its principal stakeholders. There are similar examples of such partnership at continental, regional, national, and subnational levels. The key criterion is a collaborative relationship among multiple organizations in which risks and benefits are shared in pursuit of a shared goal. Here, the focus is more on formal collaborative ventures. The goal of partnership in terms of women's health has to concern the redress of health problems of significance affecting women, especially in developing countries. The area of focus could be collaborations in product discovery and development of new diagnosis, new medicine, and new vaccine in relation to women. Or it could be to support for improved service access and technical assistance. Partnership can also be in the form of advocacy that raises the profile of the disease that affect disproportionately women for adequate response and resource mobilization. The uniqueness of women lies in their reproductive function. Childbearing is a normal physiological process, but is fraught with risks and unpredictability. Pregnancy can increase blood flow throughout the body and may result in preeclampsia, for example. Pregnancy can also deepen existing mental health disorders, such as depression and anxiety. Partnership can come in handy to provide support to pregnant women to take them safely through pregnancy and childbirth. This does not need to be the responsibility of the state alone. Non-health actors can play a role. The health of a woman should be everyone's business. I thank you for your kind attention.